Is COVID vaccination associated with an increase in cardiac arrest 911 calls? There have been anecdotal reports in the media with athletes having cardiac arrests at sporting events. But is there a connection between the two? Hello and welcome to my channel Medicine with Dr. Moran. I want to talk about a peer-reviewed observational study which was published in one of medicine's premier scientific journals this week. It was published in Nature. There's a link, as always, to the study in the description below. Researchers in Israel looked at the National Emergency Medical Services database to evaluate whether there might be an association between the number of cardiac arrests and acute coronary syndrome calls to emergency medical services in the 16 to 39-year-old population. They wanted to compare this with potential factors including vaccination and COVID infection. Israel has a national database on vaccination, and Israel's emergency medical system is a national organization that manages all calls to EMS, what we would call 911 calls here in North America. They reviewed cardiac arrest phone calls which resulted in collapse of the patient with no pulse, as well as a second type of phone call which we call an acute coronary syndrome, where a patient might experience a reduction in blood flow to the heart that can be associated with a heart attack. Both of these types of phone calls were based on the medical history, physical exam, and ECG by the paramedics who arrived on the scene. As I've reported in other videos, we do know that myocarditis and pericarditis in this age group is a side effect of vaccination, and it has been well studied in numerous countries, including in the province of Ontario, Canada, the UK, Hong Kong, as well as a study this week from 4 different Nordic countries, very large study. We know it's more common after the second vaccine dose in young men and more common in patients receiving Moderna vaccination, and it can be reduced by delaying the second vaccine dose and not using the Moderna vaccine in young people, which they've done in a number of countries. It's an uncommon side effect occurring in 1 in 3,000 to 1 in 6,000 men in the 16 to 24 age group after the second dose in observational studies that have been done. We also know that the incidence of myocarditis in this age group with COVID infection is significantly less than vaccination, based on both UK data and this week's large study from 4 Nordic countries. The study authors in Israel correctly point out that while the benefits of COVID vaccination are clear, especially for populations at great risk of developing serious and potentially life-threatening illness, it's important to better understand the potential risks to minimize the harm. Let's look at the results of the study. In total, there were 945 cardiac arrests and 3,945 ACS calls for people in the age group 16 to 39 out of a total population of that age group of 3.5 million. Now, of the 3.5 million, 2.3 million received their first vaccination dose and 2.1 million a second dose. There were 572,000 COVID cases in this age group. Here's a graph of the cardiac arrest calls in the age group. As you can see in red on this graph, prior to the pandemic in 2019, the number of phone calls varied from 4.5 up to 9 on a weekly basis. It remained that way through the beginning of the pandemic and through the Alpha and Delta waves in September 2020. Infections are shown as gray on the graph. There is a statistically significant increase in cardiac arrest calls in January 2021. If you look at this graph, which zooms in on the graph I just showed you, there's an increase in calls after the first and second vaccine doses. The purple line represents the first vaccine dose, and the blue line represents the second vaccine dose. As the purple line goes up with more and more people in this age group getting vaccinated, we see an increase in the red line of cardiac arrest calls, delayed a week or 2 behind the purple line. The red line continues to increase as the purple line of first vaccinations fall and the blue line of second vaccinations increase. The gray line of infection falls as the cardiac arrest call number goes up, indicating no association of COVID-19 infection to cardiac arrest calls. In addition, I want to point out that the green line on the graph shows people in this age group who'd previously had COVID, then got a single vaccine after their recovery. And as you can see, the red line of cardiac arrest calls goes up again after those single vaccinations. Israel recommended that people who had recovered from COVID receive a single vaccination. I will briefly show the two graphs for the acute coronary syndrome phone calls, which are essentially the same as the graphs from the cardiac arrest phone calls. Looking at the raw data, there was a statistically significant increase of 25.7% in cardiac arrest calls, with a p-value of less than 0.05, as well as a statistically significant increase of 20% in ACS calls, which yields a p-value of less than 0.001 for this age group during the January to May 2021, compared to the same period in 2020. Now, the p-value indicates the probability of this difference occurring by chance, so this would be less than 0.1%, very low. The percentage of cardiac arrest patients that died prior to hospital arrival increased from 52.8% up to 60.5%, which was a p-value of less than 0.001 during the same time frame. They also saw that the increase was more in females than males in this age group for the ACS phone calls. Now, the study authors make a number of points. Cardiac arrest events almost always involve activating EMS services, so the data they have in the national database in Israel is going to be complete for that. For ACS events, it's estimated that about 50% of those are walk-ins to the hospital, as opposed to people coming in by ambulance with paramedics. They mentioned that this increase in the incidence of cardiac arrests or ACS events in the population parallel the vaccination rollout, and its association with the vaccination rates could be consistent with the known causal relationship between the mRNA vaccines and incidence of myocarditis in young people, as well as the fact that myocarditis is often misdiagnosed as ACS, and that asymptomatic myocarditis is a frequent cause for unexplained sudden death among young adults who have a cardiac arrest. It's interesting to note that the relative increases of cardiac arrest and ACS events was larger in females. This may suggest the potential underdiagnosis or under-self-reporting of myocarditis in females, or other unique patterns, which is consistent with the ongoing challenge of gender-related differences related to cardiovascular diagnosis and care. In this observational study, there are limitations. We have to talk about those. The data they had did not include specific information regarding each affected patient, including their hospital outcome, what their comorbidities were, as well as vaccination and COVID-19 status. This would be helpful to determine the exact nature of the observed increase and what the underlying causal factors might be. This should be investigated in detail. They correctly point out that not every cardiac arrest stems from a primary cardiac problem, but the vast majority do. They quoted another study which estimated that between 84 to 92% of non-traumatic cardiac arrest cases are primarily cardiac, but of course there are potential other causes of cardiac arrest, for example, pulmonary embolism, which are blood clots to the lung, as well as acute brain events such as a brain bleed. So the observed changes that they saw and incidents can primarily be attributed to cardiac arrests of a primary cardiac cause. Now, I want to put this further into perspective. The fact that there's an association between vaccine administration, in this instance, the Pfizer vaccine in Israel, as that's the only one they received in Israel, and the adverse cardiovascular outcomes among young adults does not necessarily mean cause and effect. It's important to note that an association of two things does not mean that one thing causes the other. It may not. It does, though, mean that we need further research into establishing whether there might be cause and effect. As the authors state, this would be critical to better understand the risk-to-benefit ratio of vaccines and to inform related public policy and prevent potentially avoidable patient harm. So it's very important that studies like this get published, and kudos to the journal Nature for doing this. I see that reporting on this study sadly is getting censored on Twitter. Censoring peer-reviewed research in one of medicine's premier journals is disappointing, it's sad, and it's not appropriate. We need scientific debate if we're going to move forward in medicine. Please feel free to share this, and if you like my presentation, click on the like button to support my channel. People have been asking me about how my cats are doing. They're doing very well, thank you. So here's an outro video of Tiger and Sweetie sharing the love. Enjoy.